There are more than 100 different forms of arthritis and related diseases. The most common types include osteoarthritis, rheumatoid arthritis, psoriatic arthritis, fibromyalgia, and gout. Arthritis and related diseases can cause debilitating, life-changing pain and disabilities. According to the Centers for Disease Control and Prevention, more than one-third of the adults who have arthritis report that it limits their leisure activities and work, and 25% of them say it causes severe pain. The main symptoms of osteoarthritis are joint pain and stiffness, which typically worsen with age. Osteoarthritis is a degenerative disease that affects the whole joint. The protective cartilage, the hard slippery tissue that covers the ends of bones where they form a joint, slowly breaks down, making joint movement difficult and painful. Eventually, bones of the joint may rub directly against one another, causing severe pain. Inflammation is also involved in the process of osteoarthritis, which most commonly affects knees, hips, hands, and the spine. Pain intensity varies from person to person. It can range from mild to moderate and may be manageable with drugs and regular physical activity. For some, it can be severe and debilitating, making any movement of the affected joint very difficult. In rheumatoid arthritis, the body's immune system attacks the tissues of the body's own joints and other organs. The immune system normally triggers inflammation that protects a person from viruses, bacteria, and other invaders. In people with autoimmune diseases like rheumatoid arthritis, inflammation becomes overactive and attacks healthy tissue, such as the lining of the joints, called the synovium. Persistent inflammation can eventually lead to permanent damage to joints and other organs and create worsening pain in the process. Rheumatoid arthritis typically affects parallel joints on both sides of the body, such as both knees or hands. It can also affect internal organs, including the liver, heart, and eyes. Psoriatic arthritis, similar to rheumatoid arthritis, is an autoimmune inflammatory disease in which the immune system attacks the body, especially the skin and joints, causing skin rashes and pain. It typically occurs in people who have psoriasis, an autoimmune disease that creates red or silver scaly skin patches as the production of skin cells accelerates. Psoriatic arthritis can affect any joint. It may also affect the sites where tendons or ligaments attach to bones, called entheses. The inflammation commonly affects the heel or bottom of the foot and the lower back. Gout is a form of inflammatory arthritis, but it does not cause body-wide inflammation like rheumatoid arthritis or psoriatic arthritis does. In gout, high levels of uric acid are the problem. If your body produces too much uric acid, or if you are unable to remove the excess fast enough, it can build up in the blood, and excess uric acid can form crystals in joints. This results in extremely painful joint inflammation. Gout usually strikes suddenly, often in the large joint of the big toe, but sometimes in other joints. Lupus or systemic lupus erythematosus, SLE, is a complex autoimmune inflammatory disease that affects many parts of the body, including the joints, kidneys, skin, blood, brain, and other organs. It can cause joint pain, headaches, and chest pain, as well as many other symptoms, including fatigue, hair loss, sensitivity to light, fever, rash, and kidney problems. Non-steroidal anti-inflammatory drugs, NSAIDs, are often prescribed and can reduce pain and inflammation, but have many gastrointestinal as well as kidney side effects and cannot be used with many cardiac medications as well as blood thinners. Acetaminophen, also known as Tylenol, alone may effectively ease pain with fewer gastrointestinal side effects. However, taking too much acetaminophen, which is an ingredient in many over-the-counter medications, can lead to liver damage. Steroidal anti-inflammatory medications are also prescribed in some cases. Corticosteroids that you take by mouth affect your entire body. For this reason, they are the most likely type of corticosteroid to cause side effects. Side effects depend on the dose prescribed, but commonly cause a buildup of fluid, causing swelling in your lower legs, high blood pressure, problems with mood swings, memory, behavior, and other psychological effects, such as confusion or delirium, upset stomach, and weight gain. When taking corticosteroids by mouth for a longer term, you may experience problems with the eyes, such as glaucoma or cataracts, a round face, which is sometimes called moon face, high blood sugar, which can trigger or worsen diabetes, increased risk of infections, especially with common bacterial, viral, and fungal microorganisms, bone fractures and thinning bones, called osteoporosis, fatigue, loss of appetite, nausea and muscle weakness, thin skin, bruising, and slower wound healing. Regenerative medicine is an umbrella term for a branch of medicine that uses natural healing enhancers, stem cells, and tissue engineering to fix tissues that have failed to repair themselves or speed up the natural repair and regenerative process. Regenerative medicine, which is being tried primarily in osteoarthritis, has two branches. One is tissue engineering, which tries to create replacements for damaged tissue. The other is self-healing, which uses injections of stem cells or blood products to push the body to repair itself. Platelet-rich plasma, PRP, is probably most widely performed of these procedures. Blood is drawn from the patient and spun in a centrifuge to separate the platelets from other blood components. The platelets are then injected into problem areas. Your body's first response to injury is to send platelets to the site. This blood component contains growth factors and other nutrients. PRP is thought to boost that natural response. Autologous conditioned serum, also called Regenerative, uses the patient's own blood to fight pain. Your blood is processed to increase the anti-inflammatory proteins and growth factors it contains. Then it is injected in your affected joints, usually in a series of shots. Regenerative blocks interleukin-1, a key player in inflammation. It relieves pain and could conceivably slow osteoarthritis damage. Stem cells can make copies of themselves and turn into other types of cells. In adults, a small number of these unspecialized cells lie dormant in many organs and tissues. The idea that stem cells might be a source of renewable tissue for almost any part of the body is the basis for this line of treatments. Mesenchymal stem cells, which are found mainly in bone marrow and fat, are usually used for these procedures. The stem cells are separated from other tissue components and are then injected into your painful joint. The theory is that the stem cells will initiate tissue regeneration in the joint. Hyaluronic acid injections. Injecting hyaluronic acid into a painful joint, such as a knee or hip, is another great natural way to treat and slow down osteoarthritis. A thick, gel-like substance is injected to the affected area to lubricate and cushion the joint. Your body makes hyaluronic acid. It's a natural part of the fluid that helps lubricate and cushion your joints and keeps them working smoothly. When you have osteoarthritis, the hyaluronic acid in the affected joint thins. Studies show hyaluronic acid injections may work better than painkillers for some people with arthritis. Other studies have shown they also may work as well as corticosteroid knee injections without unwanted side effects. Prolotherapy is another great way to treat arthritis in some joints. In prolotherapy, a dextrose solution is injected into a muscle or joint to stimulate controlled inflammation. The result is an increase in blood flow, nourishing the tissue, removing damaged cells, and accelerating tissue regeneration. Prolotherapy is a remarkable treatment in its simplicity. The treatment can help many patients avoid joint replacement, but it is not a miracle cure. Prolotherapy injections cause a controlled inflammation to occur by mimicking an injury response. It tricks the cells into thinking a new wound has occurred. These cells then excrete extracellular matrix, which enhances the stability of the joints by tightening and strengthening the ligaments, tendons, and joint-stabilizing structures. Prolozone therapy is a revolutionary technique that is used to treat damaged ligaments in a joint. The therapy falls within the category of regenerative medicine, as it is an injection that infuses the joint with collagen-producing materials and ozone gas to stimulate natural healing. Research has proven its pain-relieving, anti-inflammatory and regenerative benefits for individuals suffering from knee osteoarthritis and rheumatoid arthritis. Prolozone therapy restores the joint and relieves pain. Ozone therapy. Researchers have found ozone has both regenerative and anti-inflammatory properties. In recent years, there has been a growing interest in the effects of ozone, which can be safely delivered intra-articularly and whose use is increasing in the outpatient setting due to the ease of preparation methods. When injected into a joint, ozone can stimulate joint repair, reduce inflammation, and may promote new cartilage growth. This therapy triggers the multiplication of cells in a weak or damaged body area, which helps relieve pain while strengthening and regenerating structures such as muscles, ligaments, tendons, joints, and cartilage. Exosomes injections are now also widely used to treat osteoarthritis. Exosomes from stem cells could delay diseases and repair joints. Injecting exosomes has several applications, including the facilitation of cartilage repair, immune system support, and joint pain relief. Intra-articular laser therapy is used primarily in the treatment of damaged joints by application of the newly developed catheter technology. It allows direct irradiation of dysfunctional tissue like nerves, cartilages, bones. There are already many scientific studies that clearly demonstrate the regeneration of cartilage tissue by means of low-level laser therapy. While red lasers are mainly used for regeneration in chronic joint pain, blue light is particularly effective in the treatment of acute inflammation. To optimize effects, the treatment may also be combined very successfully with other injection therapies like PRP or hyaluronic acid. Homeopathic injections. Homeopathic trigger point injections as an alternative to steroid injections or opioid medication for pain management. Homeopathic trigger point injections contain natural solutions injected into a trigger point or acupuncture point. The injections, widely used in Chinese medicine, trigger the body's natural response to promote healing. Debilitating pain interferes with your ability to work, sleep, and enjoy life. Fortunately, there are many forms of alternative pain management treatments that may help you experience relief from chronic pain. Strong medications with unpleasant side effects with the potential of addiction aren't your only options for finding relief from chronic pain. If you're living with chronic pain, you're not alone. You can also find information and helpful tips on many other topics by visiting our website,